I'm Dr. Ratna. I'm a clinical microbiologist and infection control practitioner at Apollo Hospitals, Jubilee Hills, Hyderabad. As of today, there has been one confirmed case of NCOV or novel coronavirus which has been reported from our country, from Kerala. So how do we prevent this infection which is causing lot of anxiety and lot of preparedness is happening around the world? What we have to do is, the best way to prevent getting infected is to avoid getting exposure to such cases. There are very few steps which can be followed to prevent this infection. First and foremost is hand hygiene. Ensure that you wash your hands regularly with soap solution, and if possible and your hands are not dirty, then alcohol hand solution can also be used. Second important thing is that never touch your mouth, nose or eyes with unwashed hands. That is another important thing, because that is one of the method of spread of the virus. Third thing is cough etiquette. So if you are sneezing or if you are getting a cough, don't do it openly. Make sure you use a tissue paper, and after use throw it in a dustbin. And the cough etiquette basically means you cough into your sleeve like this. When you cough like this, you prevent spread of the droplets which come from your nose or from your mouth when you are coughing. In addition, if you are in close contact with people who have had a history of travel and are showing the symptoms of infections like cough, fever or cold, make sure that you wear masks. Make sure that when you are coming in contact with people who are having suspicion of this infection or a history of travel to the infected countries, then wear a mask and prevent contact with such people at least for few more days. Avoid going in highly crowded places, and if you have had a travel history of going to any of these affected cases or international travel, and if you find any signs of fever or cough or cold, do meet your doctor and seek medical advice. Similarly, if there is a travel plan, it is preferable that you avoid traveling to these affected countries, as the CDC and WHO has definitely given some travel alerts to these countries. But if it is unavoidable, make sure that you, again as I said, carry your hand rub with you. Ensure that you use your hand wash and frequently wash your hands at least for 20 seconds. Avoid crowded places and do not touch your hands, do not touch your mouth, eyes or nose with unwashed hands. That is the most important thing. There is nothing much to panic. If we follow these simple infection control measures, then we can prevent the infection from occurring to us or getting transmitted to other people.